Hi, I'm Dave McGrath, and I'm well because UMass has been taking care of me and my family for 32 years. It all started back in 1983 when my older sister Carolyn was hanging out with her best friend. Her best friend's older brother had diabetes, and I guess they thought it would be fun to check each other's blood sugar. It was a good thing they did because my sister's came back as way too high. So my parents took her to UMass, and she was diagnosed with type 1 diabetes. They took good care of her, and ever since, my sister's had great control over her chronic disease. Fast forward to 1988, I had been having some really painful and embarrassing symptoms for a while, but it got to the point where the pain in my side was so bad I couldn't even stand up straight. So my parents called our neighbor, Dr. Thomas, a doctor at UMass. We called him Dr. Bob, and Dr. Bob came over and examined me, and he thought my appendix was about to burst. So he sent me and my parents to the UMass ER that night for emergency surgery. Well, Dr. Hirsch opened me up and found out it wasn't my appendix causing all the problems, it was my intestines. They had holes in them and were basically rotting away. He operated on me for over 4 hours and took out 1.5 feet of my large and small intestines. I was diagnosed with Crohn's disease, and even though I would never wish Crohn's on anyone, in a way, it was good that I had that experience because it got me ready for a few years later when I started having different symptoms. This time, I was having really bad headaches and double vision. I thought maybe something was wrong with my contact lenses, so I went to my eye doctor, and he didn't know what was wrong with me. He referred me to another doctor who didn't know. Finally, I ended up at UMass, and they ordered a CAT scan and found a tumor in the middle of my brain that was pushing on my optic nerve. Well, I was handed over to Dr. Recht, and Dr. Recht took good care of me. I was in and out of the hospital for a few weeks having various tests done. They weren't sure what my tumor was. Finally, they found a marker in my blood that told them it was cancerous. Shocking news at age 18 for a doctor to tell you have brain cancer. But UMass had taken care of my Crohn's disease. They had taken care of my sister's diabetes. I was fully confident they were going to take care of my brain cancer. I was given the oncology team of Dr. Schwen, Dr. Newberger, and Dr. Michelson, and they told me I was going to need some rounds of chemotherapy followed by radiation. When my chemo started, that first day, Dr. Bob came to visit me in my hospital room, and he told me he had read studies that said cancer patients who used visualization had higher success rates. So every time I got my chemo, I closed my eyes and I imagined the chemo going through my veins, up into my brain, and killing my tumor. Well, wouldn't you know, when my chemo rounds were done, the doctor said, "We don't know why, but you don't need radiation." And I've been cancer-free for over 20 years now. Now you'd think, with UMass helping me with my brain cancer and my Crohn's and my sister's diabetes, that would be enough. But no, the story does not end there. In 2005, I had my second kidney stone. I went to the UMass ER, and they took care of me again. Then in 2008, I had a really bad Crohn's flare-up, and I had to be hospitalized. And guess what? UMass took care of me again. This time, they gave me over to Dr. Zawacki, who is one of the most compassionate, understanding, and caring doctors anyone could ask for. He put me on some new Crohn's meds and really got my Crohn's under control. I really can't thank him enough. I was upset when he retired from patient care, but now I'm in the hands of Dr. Pellish, who's a great doctor as well, who the first time I met, I said, "You know, I've had Crohn's disease longer than you've been a doctor." He thought that was funny. Now, I've mentioned a lot of doctors that have taken care of me, but I wouldn't be here telling you this story today if it weren't for all the UMass nurses that have taken care of me throughout all of my hospitalizations. They're there all the time. They're there. They see me when I'm at my worst. They clean up all the messes that I make, whether it's puke or Crohn's related. So thank you to all the UMass nurses. I think what you do is an amazing job and unbelievable. Now you'd think that that would be the end of the story, but it's not. In 2012, my mother was diagnosed with uterine cancer. And once again, she went to UMass and they took care of it. And she's been cancer-free for 3 years now. So I really cannot thank UMass for taking care of me and my family for such a long time. And we're all here to tell the story, and I think that's a reflection on the great care that UMass provides. I really can't thank you enough. UMass doctors and nurses, thank you.